I'm Amarbir Bhullar. I'm a cardiac electrophysiologist. I started working at King's Daughter Medical Center in July. Cardiac electrophysiologist is basically treating the various heart rhythm disturbances. So the various heart rhythm disturbances can be ranging from like conduction disease, arrhythmias. So we take care of that. So we deal in placing pacemakers, defibrillators, and ablations for various arrhythmias, which can be arrhythmias coming from the top chamber of the heart or arrhythmias coming from the bottom chamber of the heart. During my cardiology training, I was really fascinated by how our heart's conduction system works. So I would always read more about it. And then I started working more with our electrophysiologist over there. So I would deal more with ablations, arrhythmias. So it just really fascinated me. It's like a part of the cardiology which is really intellectual, and you deal with procedures, and you always have like patient interactions. So it kind of offers like a balance of everything. Cardiovascular diseases are the most common diseases in the US, and arrhythmias being one of them. Atrial fibrillation, for example, is the most common prevalent arrhythmia in US, and there is a lack of knowledge and lack of understanding among general population about what AFib is. And the most important thing is to catch AFib early on. The longer they stay in AFib, the success rate of all the therapy goes low. So that's one of my main reasons to be in like cardiac electrophysiology, to help people help treat the arrhythmias. So the various risk factors associated with AFib are diabetes, high blood pressure, obesity, sleep apnea. So if you have a lot of risk factors and you're having episodes of palpitations, then it's a good idea to be evaluated by a cardiologist to get an EKG or a long-term monitoring to see if you have atrial fibrillation or not. The symptoms can range from palpitations like feeling your heart is racing, feeling of skip beat, and some people just feel fatigued and tired. And a lot of people don't feel anything. So there are various ways to diagnose a cardiac rhythm disturbance, ranging from one-time EKG to ambulatory EKG monitor. There are two kinds. One is where the patient wears a patch on the chest, and the patch can be ranging from like 48 hours to 4 weeks. And in some cases, when the arrhythmias are really infrequent, we can put a small chip underneath the skin in the chest, and that chip can last for like 2 to 3 years. And that's more for those patients whose arrhythmias are coming less often, less frequent. So I did my internal medicine residency at UCSF Fresno in Central California, so where I subsequently did my cardiovascular disease fellowship, and after that I moved to New York to do the EP fellowship, and I finished that from Northwell Health in New York City. I grew up in a small town, and same true for my wife, so when I came here to visit, I really liked this town and I could see myself living here, raising a family.